The coronavirus could push the Eurozone into a recession. The warning comes from the OECD, which says the outbreak poses the gravest threat to the global economy since the 2008 financial crisis. For now, the EU's Disease Prevention Agency has upgraded its risk assessment as the virus spreads to more member states, the latest being Portugal. The President of the European Commission, Ursula von der Leyen, has now set up a special coronavirus response team that will focus on the impact of the outbreak on health, travel and the economy across the EU. So far, the bloc has reported more than 2,000 cases and 38 deaths from the respiratory disease known as COVID-19. Worldwide, the disease has killed more than 3,000 people and infected around 89,000. The EU's Health Commissioner, Stella Kyriakides, insists the situation is different from one member state to another, but that the bloc is working to ensure they're all well prepared and that they coordinate their response to the outbreak.
In the EU at the moment, we're at the point of containment. Containment means that what we are doing is early diagnosis, contact tracing and following up from that on. So each member state has their action plans in place and they decide, according to their situation, what measures they should be taking.
Well, our correspondent Jack Parrock joins us now from Brussels. Jack, what more can you tell us, first of all, about this new European response team that's being set up?
Good afternoon. Well, what they're trying to do is put together this response team so that they have in place a unit to look into how they're going to respond to the COVID-19 virus. As we know now, 38 people have died within the European Union. It's taken hold in 18 countries. And what the President Ursula von der Leyen has done is put together a set of commissioners which include the Health Commissioner, the Crisis Management Commissioner, the Transport Commissioner and the Commissioner in charge of borders and also the Economy Commissioner to try and make sure that the EU has a response together to make sure that those units are all working together to try and make sure that if the outbreak takes hold further, that they have a way of dealing with it, Alistair.
And we have these warnings now about the possible threat to the Eurozone going into recession from the OECD. What's the European Commission saying about this, and what could the EU do to try to head that off?
That's right. So not only have they raised the threat level from moderate to high, but we've also had the OECD in Paris saying that this could push a global recession of 0.5 percentage point potentially. And they're saying that that could push the Eurozone and Japan into recession. And that would obviously be a big issue. And that's why we saw Paolo Gentiloni, the Economy Commissioner, put into this team. He, during the press conference today, said that the European Union will do everything it can. It will use all the possible economic measures disposable to ensure that it doesn't push the Eurozone into recession. But there is a lot of concern about that. Obviously, with people unable to fly, with big events across the European Union being cancelled, all of these things have big economic ramifications, and the EU wants to make sure it's safeguarding itself as much as possible.
Jack Parrock in Brussels, thank you. Well, in France, authorities have banned indoor public gatherings of more than 5,000 people, and the Louvre Museum in Paris has been closed as a precautionary measure. At least 130 cases have been confirmed nationwide, and schools have been closed in several towns north of Paris, in the Oise area, where most cases have been concentrated so far. Our correspondent Annelise Borges joins us now live from Paris. Annelise, we hear that President Macron is clearing his diary to deal with the coronavirus outbreak. How significant is that move?
Quite significant, Alistair, so much so that his team actually found pertinent to clarify to the public that Emmanuel Macron is not sick, nor is he presenting any kind of symptoms that could be associated to the COVID-19. He is simply cancelling some of his trips in order to try and to focus his attention on the response to this crisis. The French Prime Minister is also very involved in this. This is an attempt, of course, on the part of French authorities to reassure the public that they are not taking this situation lightly. Edouard Philippe, the country's Prime Minister, was seen at a hospital in the city of Bordeaux earlier today, where he spoke to journalists and addressed a message to the French public saying that Really, he wants them to remain vigilant. He's asking people to avoid, for example, la bise, kissing, which is a very French habit, and shaking hands, but also asking the French public to avoid panicking at this stage.
And kisses and handshakes aside, how are people around the country dealing with this now?
Well, as you mentioned, several schools have been closed in the Oise region, the worst hit region in France, where 47 cases have been registered. At least 30,000 students, roughly 30,000 students, are now going to stay at home for the next 2 weeks, Alistair. And in that region, all public gatherings have been cancelled. Residents there are also being asked to limit their travels. And as you mentioned, across France, all indoor gatherings of more than 5,000 people have now been banned. That is, of course, an attempt to trying to prevent the further spread of this virus. And we are now getting reports that the hospitals here in France are going to start adopting a new strategy in view of the spike of the number of cases in recent days. They are going to start discharging mild cases from hospitals. Up until now, every single person that was diagnosed with the COVID-19 was hospitalized. And now the rule is going to change. People that do not present any kind of associated risk factor will be sent home. Of course, questions remain as to whether or not this is a coherent measure in view of the other measures that are being adopted in France. But hospitals are saying, and healthcare personnel in hospitals are saying, that this is the only way not to saturate the healthcare sector here in this country and public hospitals for now.